So I think we talked about a lot of important points today. So I think we talked about screen addiction, we talked about depression, we talked about anxiety. So when do you think, doctor, is the right time to ask for professional help? When is the right time to come see a psychiatrist?
I think I usually give this analogy of the red, yellow, and green traffic light. You know, so green is when everyone is happy, relaxing. Things are going well. Yellow is when things are a little bit not going well. Feeling angry, feeling upset, feeling mad. And the red is when someone is saying, I don't want to live, I want to die, throwing things, trash. So these are all the red, yellow, and green. So in each mental health disorder, you can say there are those, let's say depression. The green is when you are happy, yes, there is some sadness, but you're bouncing back. Yellow is when you have been, sad, down, isolated, not enjoying things, but still able to go to school, still able to eat, still able to sleep. And the red is when you are having negative thoughts all the time. You are feeling, I want to die, no one loves me, no one care about me, you're not sleeping. So these are some so in anxiety, let's talk in the normal green. You're a little bit worry when the exams come, little bit worry maybe going hide, but overall able to manage.
Yes.
Yellow is when, yes, you have lot of worries, sometimes you may get some panic attack, but still able to go to school, able to eat. So their symptoms are there, but you are able to push through it. And red is when those are so severe that you are not able to go to school, you are having stomach ache, you are unable to complete the exam, you are unable to take the ride, or let's talk about so any symptom have behavioral issues.
Yes.
You are getting upset with siblings here and there, those are green. Yellow is when things are, yeah, you are getting mad, you are getting upset, but still it's not affecting that someone is seriously getting hurt, and still you are, after maybe the fight 10 times in a day, you're still playing together. And the red is when the someone is getting hurt, and also so these are red, yellow, and green.
Okay.
So I think as a parent, I always say there are symptoms of red, yellow, and green. Similarly, you need to identify what have helped in my child the last time when they were in the yellow zone, and what you have done that took them to the green.
Okay.
But the most important thing, what you have done that turned them from yellow to red. Because children are, they go from 0 to 100 like this.
Yeah.
So you have to find ways, and then so whenever your child is in red zone, when they are saying, I don't want to live, I want to die, no one loves me, no one, and they have been saying it consistent basis, and they have missing school multiple times, they are getting into argument, their school performance is getting affected, they're socially, a lot of issues. So those are some of the signs when it is happening consistently. Then those are some signs that are indicating that you need a professional help. And when and these are, if we identify these symptoms earlier, there we have a lot of great, the therapies, the medication, lifestyle changes, and other ways that we can help those children and those families.
Okay. I think a lot of parents have concerns when their child is suffering from depression or anxiety. Is the medication going to cause a side effect? Is there any other forms of treatment? So maybe we should explore the other forms other than medication.
Of course. So remember the same thing, the red, yellow, and green.
Okay.
There is some kind of depression and anxiety that can be treated first with therapy. Let's say the child is struggling with depression, but there is not suicidality. So we always suggest to treat it with what you call the cognitive behavioral therapy,
Yes.
where they help you identify the pattern, the negative pattern, and how it is affecting your behavior and how we can help them. Similarly, there's a family therapy when there is some family dynamic is going on that is contributing to that. So we talked about that. Parenting strategies, sleep hygiene, the healthy lifestyle. If they need any sport in the school, some physical activity, some children they need some behavioral modification. So those are all strategies that we can bring. But if the child is already have suicidal thoughts, or if you are trying this all these strategies, let's say for 3 to 6 months, it's not working, then I would say that's where it's good to have discussion about the medication.
Okay. What about patients with ADHD?
Mhm.
Since ADHD mainly responds to medication, not as much as anxiety and depression could respond to therapy.
That's true. So ADHD, so in especially in child psychiatry, if you're talking about definitely anxiety, depression, we suggest
Mhm.
the therapy first, unless it's very severe. But in ADHD, in what the guidelines are showing, the medication plays a huge role, because I often give this analogy, that there are a lot of time people, especially with struggle with ADHD, where their executive functioning is impaired, and many time they want to do things but they have difficulty. Like many time parents come to me, my child can hyper focus when play video game, when they in the gym, but when they have to do homework they cannot focus. So this is, my child is manipulating, it's intentional. And I tell them the ADHD is not a problem paying attention, it's a regulation of attention. They can be focused in things that are interesting to them, but they cannot focus in things that are boring, that are requiring more efforts. Many times parents bring a lot of fancy planner and all those things, but children, I have seen, despite all those things, it's very hard for them to execute. And that's where medication plays a significant role for helping them where they are and helping them to go where they want to be.
Okay, and I think the good thing about ADHD medication is that there are different forms and different dosages
True.
that they can give throughout the day. Sometimes parents think that they have to take it daily, but I think you were mentioning, as you had a discussion with one of the families, that maybe that he or she can take it when needed.
That, yes. So good thing about the ADHD medicine that
Mm,
we have so many different kind of medications. We have medication that help for 4 hours, six
mm,
hours, 8 hours, 10 hours, and for your interest, so lately people were realizing that some kids with ADHD, the morning is a disaster. So now we have one medication that you take it at night and it start working 12 hours after you take it. So the moment child wake up, the medication start working, so help with the morning syndrome. So we have so much varieties
yeah.
of it. And the good thing, as you mentioned, like
Mm,
if they are not very hyperactive, impulsive,
mhm,
and their social and their ADHD is not affecting their lot of social
mm,
activities, sometime when they are on vacation, sometime on the weekend,
mm,
we may suggest maybe it's okay to not take it. And similarly, sometime there are, as I said, some medication you can just, though those only help for a few hours.
mm,
Let's say if you need on the weekend, instead of taking a longer acting
mm.
or a higher dose, you just take a short acting for a smaller dose, and that will help you to just stay focused during that time.
Okay, during that specific task. So, is there like, I mean, other than medication, like, can an executive coach in school help? Can one-to-one tutoring also help them?
Yes, so one-to-one tutoring definitely
Mhm.
help, because ADHD, as I mentioned, children, it's not about paying attention; it's a regulation of attention.
Attention.
So when they have someone one-to-one, when they have accountability, yes, they can really good focus. But realistically, it's very hard to have that one-to-one all the time, and that's why sometimes it become very exhausted for both for the parents and for the school to provide that, unless it's a very specialized school, and sometimes that come at a lot of cost.
Yes.
Yes, so one to one, all those services will help them,
Mhm.
but again, the the moment those services will go, it's hard for them to utilize it. And so so that's where in ADHD I
Mhm.
highly encourage to consider medication and start very low dose, gradually go up, because we see a significant change, in their functioning, in their academic performance, in their social, in their self-esteem, when they start taking these medications.
Okay, I think that was a very nice and productive talk, and I think the take-home message is it's important to read the body language of your child, and it's important to see where they stand. Are they
I
at the
agree.
green, yellow, or red?
Yep.
And I think we have a clear idea on when to seek professional help, I would say.
Thank you.